Chapter 2, The Unlearned Lesson, How America Failed Before COVID Even Arrived. 2018, The Warning We Erased. The exercise was called Crimson Contagion. A year-long simulation, it predicted nearly everything that would go wrong in 2020. Personal protective equipment shortages, hospital bed crises, conflicting federal and state responses. But in 2018, the White House shut it down. The final report was buried. The pandemic playbook was left to rot. By the time COVID-19 arrived, the cost was measurable: 37% slower contact tracing. The virus spread unchecked through nursing homes in Kirkland, Washington, subway stations in New York, churches in New Orleans. The early window to contain it had already closed. 2019, the stockpile that never was. The Health and Human Services Inspector General's report should have been a 5-alarm fire. Instead, it landed with a thud in bureaucratic silence. 90% of the Strategic National Stockpile's PPE was expired, depleted, or missing. No one restocked. No one cared, until nurses were sewing homemade masks from old scrubs and garbage bags. "We were told the system was ready," said an ICU nurse in Detroit. The system was a lie. 2020, the unforced errors. Testing, the original sin. The CDC's first COVID test kits were flawed, contaminated. For weeks, labs couldn't confirm cases. By the time replacements arrived, the virus had already taken root in Seattle, New York, Chicago. "We were flying blind," a former FDA official confessed. By the time we saw the fire, the house was ashes. The Two Americas, Denial versus Data. February 26, 2020. It's going to disappear like a miracle. President Trump. Same day. Community transmission is inevitable. Prepare for lockdowns. Dr. Nancy Messonnier, CDC. The result? A nation split in two. Red states resisted restrictions, mocked masks. Urban ERs became war zones. Refrigerated morgue trucks idled outside hospitals. South Dakota, 2.1 times higher death rate than Vermont. New York, 1,000 plus preventable senior deaths. California, 22% fewer excess deaths than Texas. Epilogue, the autopsy. The bodies were counted, the studies published. The verdict was inescapable. Unnecessary wasn't an opinion, it was a math problem. And America had shown its work. The next pandemic is coming. The only question is whether we'll call those deaths unnecessary too.